let's talk about foreplay, what it is, why it matters, and some of my favorite strategies to incorporate into your intimate life, especially if you are experiencing pain with sex. All right, so what is foreplay? Foreplay typically refers to the things that lead up to, or the things that are done, I guess, in preparation for or in anticipation of sex. And sex can obviously vary. It so depends on what your definition of sex is. That could mean straight up, penis and vagina, penetrative sex. That could mean oral sex. That could mean just intimacy with yourself, with whether that is your hand or a toy, whatever it is. Obviously, we know definitions of sex vary widely, but foreplay refers to the things that come before that. And we know that for women, especially with individuals who have that female anatomy, foreplay is extremely important because it allows us to become sufficiently aroused. It allows us to become relaxed and more in tune with our bodies, and really to be able to fully enjoy sex with whatever that may be, which today for this video, we'll talk about it being really penetrative penis and vagina sex. So that's what I'm going to refer to as sex from here on out. Sexual intercourse, we'll say. But really, foreplay allows us to get into the right headspace, or it should help us get into the right physical state of being, the right mental state of being, the right emotional state of being. So why does this matter? Now, obviously, just like I mentioned, foreplay is so important because it helps prepare our bodies, not only physically, but emotionally as well, for what's about to happen. And then lastly, in this video, we're going to talk about some of my favorite strategies to help if you are experiencing pain with sex, and kind of what that looks like. So I think one of the most important things when it comes to foreplay is that ability to voice both your needs and your wants. And I know that can be really tough, and that can be really challenging sometimes. I'll speak from personal experience. I know that I have been with my husband. We've been married for 5 years. We've been together for several years past that. I think like almost 15 years. We've known each other for a while. And regardless of how long I've known him, how well he knows me, I tend to be shy in the bedroom. I tend to not really voice exactly what I want, or what I am interested in, or what's kind of flitting across my mind as far as my desires. And that can be challenging sometimes. And so I think that I will put a little note in here. If you are experiencing a lot of anxiety around sex for whatever reason, especially if you have gone through trauma in the past, if that's a part of your lived experience, please know that working with a sex therapist can be so beneficial, or even just a licensed mental health counselor. That can absolutely be a game changer when it comes to anxiety or fears or worries regarding sexual intimacy. But I think something that's really, really neat, and something that we can often do, is just describe to our partner, hey, like, it really, really feels good when you do this, or I'd love it if you could try that, or whatever it is. But really taking the time to be vocal and expressing what our needs are and what our wants are too. Another thing I want to make sure that I point out is another reason why foreplay is so important. And I should take a note and say here that foreplay should be a sufficient amount of time. Now, obviously, everyone's going to be different. You often hear about analogies about, men are like microwaves. They can just turn on just like that. And then women are like ovens. They take a while to kind of preheat and get to that right temperature. While I do think that generally speaking, that does fit the majority of the population, obviously there's always going to be, men that maybe take a little bit longer to become aroused. And I'm sure there are women out there who can get aroused instantly just like that. But the reason why I often emphasize sufficient amount of time for foreplay is to allow for something that is called vaginal tenting. Now, what is vaginal tenting, you ask? Obviously, that's a very clinical, kind of sterile term, but all it refers to is essentially how, when myself, as a female, as a woman, as I become sufficiently aroused, the vagina, the vaginal canal, it actually expands and it lengthens inside. And it actually, so that the uterus itself and the cervix kind of pull up and tilt away and kind of lengthen. They help to lengthen and tent essentially the walls of the vagina. We know that majority of women, they do become aroused, or when they become aroused, they become lubricated as well. This is commonly known as becoming wet or getting wet. And so that is also important just to prevent friction, which can lead to micro tearing, which can lead to pain. So a huge reason why I emphasize foreplay, and the reason why foreplay is so important, is because I want to make sure that myself and the women that I work with, they're becoming sufficiently aroused so that that vaginal tending, that expansion, that lengthening occurs, and so that the vagina becomes lubricated, or that individual, their vagina becomes lubricated enough sufficiently so that intercourse is not painful. Okay, so let's talk about some of my favorite techniques as to what that can look like, what foreplay can look like. And then we'll also hit on strategies if you are experiencing pain with sex, okay? So my first thing is really just getting your hands on your partner. And what I mean by that is a full body massage. Oftentimes when it comes to anxiety or worries with sex, or sometimes performance anxiety, or whether there's been trauma in the past or whatever it is, something that can be really calming and grounding is just simply laying your hands in a gentle and loving and soothing way on your partner. And one of my favorite ways of doing that is that full body massage. So what I mean is, let's say, I'm gonna use myself as an example. So I'm going to lay on the bed, I'm gonna lay on my tummy, and I'm gonna have my husband massage my entire body. So he's gonna work from my feet, he's gonna go up my ankles, my calves, my legs, massage my booty, go through my spine, my upper back, my neck, my shoulders. I'll flip over. He can obviously do the front side of my body, and really spending time to connect. And not just, I think sometimes what happens with foreplay is that we often rush to the hot spots, right? The sweet spots, breasts, vagina, vulva, for men, penis, testicles, all of that. But oftentimes we forget that these other parts of our body feel good as well. And so we need to connect on those parts as well. So really spending that one-on-one time with your favorite oil, your favorite massage cream, lotion, whatever it is, that can be such a sufficient, or such a wonderful way to explore and to spend time during foreplay. So let's talk about if you're having, so here is my pelvic model. Let's talk about what happens if you're experiencing like a sharp, stabbing, ripping pain, or like a needle-like pain, very, very specifically, with initial penetration. How do you address that? So one of my favorite strategies, I'm going to show it here with the model. So when I refer to that like sharp kind of ripping, stabbing pain, or even like hitting a wall type pain, I'm referring to, here is the vaginal opening right where my finger is. And then the pain that oftentimes women that I work with in the clinic come to me with is the pain that's right here. So pain right at the opening, the entrance of the vagina. Now, I will say this, if you have not seen a pelvic floor therapist, please see one. They will be able to guide you and really give you that one-on-one care that can make such a difference in your journey. But if you don't have access to a therapist that you trust or can get to, these are some strategies that you can use to really address that, okay? So once again, this kind of goes back to the massage. What I will have my clients often do is, let's say the woman is experiencing, the individual who has this anatomy, she's experiencing the pain. I will have her lay face down. Obviously, this is done with her partner in the privacy of their home or wherever they are engaging in this intimate time with each other. So what I'll have them do is lay down. The female will lay down, and I will have her partner spend time massaging through her glutes. So the reason why I'm going to show this here, so glutes right here are, obviously they're kind of covering all these bones right in through here. And what I want the partner to do is really take his or her, I should say, take their hands and massage up through the back of the thighs and really kind of put their fingers in close to where the anus would be, and really massage through the clefts of the glutes. Okay, so the folds of the glutes, they're going to take their thumbs gently, massage, and they're kind of essentially spread the cheeks apart. And the reason why that's important is because if you look here, once again, here is our vaginal opening, Here is the perineum, which can often be really sensitive or painful due to various reasons. So when you're massaging the glutes and kind of opening and spreading through the glutes here, you're going to get a little bit of a stretch in through this area here. And this can help this area relax, and that will feel much, much better. It will relieve tension. It can relieve tension, which can then just create all in all such a better experience for both individuals as they engage in sex together, as they engage in that intimate time together. So that's one of my strategies. Another strategy that I have for intimacy, pain with intimacy in particular, here is another model of the pelvis. So let's say that, you know, we want to go ahead and kind of massage directly now to those tissues. So if you're looking at the pelvis here, this is a little bit complex, but essentially up here is pubic bone, down here is tailbone, and this is the vaginal canal, and this is the anal, or where the rectum is, or I should say the anus. So anus, vagina. So essentially what you'll do, I'm gonna grab my other model here actually, this will make a little bit more sense. Right here, the partner can take their finger with lots of lube on it, put their finger right to the opening of the vagina, and they can gently massage through these tissues and these muscles here. I often say this doesn't need to be more than just like fingernail or fingertip, so in other words, up to first knuckle, but that's about how deep you'll go. I would like the person who's receiving, on the receiving end of this, to really breathe. Imagine everything opening up, blooming, blossoming open as they are having their perineum or these muscles down here, their pelvic floor muscles, massaged and worked on, okay? So this is often something that I prescribe or I recommend to my clients, and I say, hey, like, engage if this is something you're open to and you are comfortable with. You know, have your partner perform oral sex while you're doing this or while they're doing this. They don't have to, they can. I want it to be pleasurable. I don't want it to ever be painful. These are strategies that you can use to reduce the pain and hopefully even eliminate the pain altogether. So there you have it. Those are some of my favorite strategies and tips on foreplay, why foreplay is important, what is foreplay in the first place, and why it's such a great way, or how it's such a great way that we can connect with our partners, and really the strategies that we can use to reduce any pain with intimacy. All right, take care, and we'll see you in the next video.